So a dispute between the Road Accident Fund and some private ambulance services could leave accident victims waiting for hours before help arrives. That's as the Road Accident Fund insists that it will only honor claims that are accompanied by a police accident report, which is not always readily available and in fact delays claims. Oliver Wright is the CEO of Private Ambulance and Emergency Services Association, that's SAPAESA, and joins us now via our video link from Johannesburg to give us a better sense of the nature of this dispute. Oliver, it's great to see you. Thanks very much indeed for making time to chat to us. It's the kind of problem that could quite literally cost people their lives. Help us understand here where the rubber hits the road. Excuse the pun. Is the issue around the police accident report?
Yes, largely. Unfortunately, the Road Accident Fund is refusing to pay any claims that aren't accompanied by a police accident report. And as we're all well aware, the South African police services are stretched to a beyond breaking point at the moment. They're dealing with serious and violent crimes, and often the majority of cases, they just don't have the time to attend accident scenes and to open these required accident reports. So it's literally making it impossible, unfortunately.
So what does this effectively mean? If there's an accident that's taken place, you aren't able to claim from the RAF until there's this report. This report is not forthcoming because police are overstretched.
Yes, essentially we can't submit something that doesn't exist. And at the end of the day, people generally only open an accident report now if they need to claim for an insurance repair on their vehicle. And as we also know, the majority of vehicles on South African roads these days aren't insurance covered. So if you don't need to claim from insurance purposes, and unfortunately, if you're a driver that's worried about criminal prosecution, a lot of them simply don't go to a SAP station to open the accident report. And if the report doesn't exist, then you can't submit the claim. It doesn't mean the accident didn't happen. It doesn't mean that services weren't provided to the patient. And it doesn't mean that they're not actually entitled to claim from the fund. It simply means that the fund is going to refuse to pay because of the technicality that the SAP's accident report isn't available.
Has this always been the arrangement, though, the need for this kind of report before any kind of claim can be made?
No, certainly not. It came as a shock to us, a very unfortunate surprise. The previous two CEOs of the Road Accident Fund have both been very, very engaging with the industry, not only the private ambulance industry, but the greater private medical industry, doctors, specialist hospitals. And what they would do is they would accept that if there wasn't a SAPS accident report available, that the medical service providers could actually generate their own accident report based on what the paramedics saw when they attended the accident scene. And they would accept that internally generated accident report as a replacement for the SAPS accident report. And then without any consultation to these same medical service providers, suddenly the goalposts were moved. Not only were they moved, this new condition was also applied retrospectively. So suddenly claims that had been outstanding for a year and hadn't been paid were suddenly being rejected. And the Road Accident Fund was asking us for SAP's accident reports for accidents that we'd already attended a year ago and submitted claims for, and that the Road Accident Fund were overdue on payment for.
Sure. There was no consultation before this change, but have you at least been given reasons why the change actually took place?
The Road Accident Fund will claim that they're trying to cut down on fraudulent claims. Unfortunately, there were many other options available to them to do this. And we've reached out to the Road Accident Fund on numerous occasions. I've personally written a formal letter to the CEO, the new CEO, Mr. Collins Letswalo, the new CEO of the Road Accident Fund. I've asked him if we can meet. I have requested the opportunity for a workshop to look for alternatives, and not only has he not come back to me, but he's also simply failed to courteously respond to any of the emails or communications that I've sent through to him. So it just seems that there's an absolute lack of willingness to engage on the matter.
which is really concerning given the possible ramifications from here on. As you say that, let me also put it on the record, Newzroom Afrika did also try to reach out to the RAF to have this conversation alongside you. We also yet to get any kind of response from them. So just so our audience knows about that. Let's talk about the impact this is having on you as SAPAESA, Oliver. I mean, if this is also being applied retrospectively, I imagine you've lost a significant amount of money.
Absolutely. Conditions that were already laid out and that were generally accepted by the Road Accident Fund were literally changed at the absolute last minute, the 25th hour, as I said, without any consultation at all. And what we suspect is that because the Road Accident Fund was in such a dire financial position, largely due to their own mismanagement and internal corruption, I may add, that they just suddenly decided that the only way to get out of these financial obligations was to make it so difficult to claim that suddenly the claims would no longer be valid. So a claim that was valid yesterday is suddenly no longer valid today. And it just seems that it's not really an effort to clamp down on corruption, but simply to do everything and anything possible to avoid any sort of obligation to pay valid claims.
The real worry now is that it's a huge disincentive for private ambulance companies to attend to those who've been involved in accidents but are not insured.
It's incredibly sad. Unfortunately, at the end of the day, there are overheads that have to be covered. The private ambulance services don't receive any sort of subsidy funding from government, from the Department of Health. So they are paid per call that they attend to and per patient that they transport to the hospital. So if they're not being reimbursed, they have no way to cover their overheads. The vehicles payments need to be made every month. There's liability insurance that needs to be covered. The staff costs are horrendous. As you know, the cost of fuel in South Africa is excessive. And you have a responsibility to be able to continue to pay the salaries for the staff that you employ. They aren't going to continue to work for nothing. They have their own financial obligations at the end of the month. And unfortunately, if you continue to do work that isn't reimbursed, your service will very quickly collapse. And that is very irresponsible, not only to the staff members and their families that you employ, but to the communities that you service. If these ambulance services collapse, especially now during COVID times, if they collapse due to non-payment, who's going to be there to continue to service not only the accident cases going forward, but all of the other medical cases and hospital transfers that we attend to on a daily basis?
Sure. Really concerning in a context also where we're approaching the festive season. We know typically, sadly, in a country like ours, that means there's a likelihood of more accidents on the country's roads. The sense I'm getting from you is that a lot of those people may very well not have the urgent attention that they need, because a lot of ambulance services are worried that their claims might not actually be fulfilled, claims to the RAF at least.
Sadly, that's definitely the case. I don't think it's anybody's intention, and I think it's a big concern for us as an industry as well, for the various operators, because they want to be able to attend these cases and they want to be able to help the communities. Unfortunately, again, at the end of the day, they need to be able to keep their doors open. So if they aren't able to meet their financial obligations at the end of the month, they need to look at alternative ways of generating revenue. So if they can't attend to motor vehicle accidents and get paid by the Road Accident Fund, they then have to attend to other calls. So they have to do hospital transfers. They're doing them already, but they have to increase that volume of hospital transfers that they do, and they need to do more medical emergencies from home, heart attacks, strokes, sporting injuries, or other types of medical emergencies. They need to attend those instead. And if they're attending those instead, the ambulances quite literally are not available to attend to these motor vehicle accidents. Quite a few services have already had to scale back on their operations because they simply don't have the cash to cover their overheads. And those that are still operating are now focusing their resources elsewhere. So at the end of the day, patients are going to be reliant on the provincial ambulance service to assist them. We know that the provincial ambulance service is stretched way beyond capacity at the moment. So that means that, like you say, they then go into a triage queue, and as soon as a provincial ambulance is available, then it is dispatched to the accident scene. That may be an hour later, it may be 3 hours later. We saw recently the Eastern Cape only has approximately 300 operational ambulances for the entire province, and the estimate is that it should be closer to 1,000 for the province. So you can see the problem there.
Yeah, we've also covered many stories where even in Gauteng, for instance, the number of ambulances available for a certain population has left a lot to be desired. Oliver, very quickly though, if the RAF is worried about possible fraudulent claims, I imagine you'd also have an interest in solving that problem without creating this inconvenience. What kind of solutions is SAPAESA bringing forward about ways through which the RAF can tighten the knot around people who are trying to make the most of these loopholes?
Absolutely. For us as an industry, it's essential that the Road Accident Fund remains sustainable. If the fund is not sustainable, it cannot continue to fund claims going forward and continue to support the community and those injured in accidents. So we would look to engage with the Road Accident Fund to put internal procedures in place where they can investigate the accident reports that are submitted themselves. In the past, we always provided them with contact details for everybody involved, witness statements, drivers, passengers, the injured parties themselves, and the Road Accident Fund was able to approach all of those people themselves to confirm the validity of the accident or not. Also, the Road Accident Fund failed to take any steps to exclude or to blacklist any ambulance services and other medical service providers that may have been submitting fraudulent claims. So it's really a blanket change. If they only weeded out the bad apples by ceasing any sort of fraudulent or irregular claims to them, the problem of fraud wouldn't have existed in the first place. So it really took just a little bit of finesse to solve the problem. Instead, they've just taken a sledgehammer to it.
Sure. Really, really worrying story. Thanks for giving us your take. Appreciate your time on the AM Report this morning. Oliver Wright is the CEO of the Private Ambulance and Emergency Services Association, known also as SAPAESA. Once again, we've reached out to the RAF. They haven't responded to our request for an interview. As soon as they do come back to us, we're more than willing to give them the next available slot. Once again, Oliver, thanks very much indeed for your time.